Hey everyone, it's Dr. Jolene Brighten, I'm the leading expert in post-birth control syndrome, and today I am chatting with Mel about her journey with hormonal birth control. Welcome, Mel, and thank you so much for taking the time to chat with me.
Thank you so much for having me. I really appreciate it.
So I would like to begin this with, how did you come to start hormonal birth control, and what did that look like for you?
So I was in my freshman year of college and I had my first serious boyfriend, and we decided that birth control was the right option for me so that we could prevent pregnancy. And that's kind of how it all started.
That's exactly why we should take birth control.
Yeah, totally.
And the thing about that is that you're in the minority of why women start hormonal birth control. In fact, most women start it because of symptoms. So when you started it, so you started with the pill, correct?
Correct. Yeah.
And how was that for you? Did you have any side effects or issues when you started?
Yeah, I had so many side effects. Once I started taking the pill, it was probably like a month after I started really going into a deep depression. Like I said, I was in my freshman year of college and I stopped going to my classes. I couldn't get out of bed. I just had like a dark cloud over me all the time. I gained about 15 pounds, and just mentally, I just was not happy at all. And I didn't know what was going on. I had no idea that it was the pill that was causing this. And so it was just really scary. And I went to my doctor and I told her all of these symptoms that I was having. And she did like a mental checklist with me, and she diagnosed me with bipolar disorder,
Oh my
which I
gosh.
which I don't have. And it was just, and so she put me on fluoxetine. And so I was taking more medication for my mental instability, and it was just a really hard time.
Yeah. Wow. A diagnosis of bipolar based on a checklist. And was this a gynecologist or a primary care?
It was my primary care physician.
Wow. Yeah. That's definitely something that, is really more in the psychiatrist and psychologist arena. So,
I
like,
agree. I
the
agree.
exploring, that's really mind blowing. And that's the unfortunate thing, is how many women get on hormonal birth control, experience side effects, and then are met with more medications. And nobody really stops and checks and says, well, hold up, could the first medication be the issue and what's involved here? And the other issue with that is that we always expect there to be some weight gain when women go to college. And so that's something that I've also heard from many patients that I've worked with, where they started the pill because they were going to college. They had rapid weight gain. They couldn't understand it. And their doctors were like, well, it's just the freshman 15. Like, that's just normal. It's normal to gain weight. It's normal to be anxious or to be sad because now you're away from home. And it's one of those things that I think our doctors kind of start that story with us when we're young. And then what I see is that over time, women start that kind of self-talk as well, where they start rationalizing their symptoms and being like, no, this is just the new normal. So you sounds like you had a sneaking suspicion that the birth control pill was involved. How long did it take you to really, kind of put your finger on it and say, okay, I think this is my problem?
Probably about 5 years after that, I was talking to girls that I worked with at a college bookstore. And, they kind of told me like, oh, the pill made me really crazy. Like, it gave me all of these irrational thoughts and suicidal thoughts. And I was like, oh, maybe that's what was happening with me. But when I went to my doctor, she never brought any of that information up to me. I had no idea that the pill could be causing that. I had no idea that I could try a different type of pill. So that's when I kind of figured that out. But it wasn't until about 10 years after I came up that I started the pill that I kind of dug more into that and became interested.
Yeah. So 5 years. So you struggled for 5 years before you kind of caught on to it. So they were giving you medications for your mood. Did that help at all?
It sort of did. It kind of put me in a fog. I sort of had tunnel vision where I just had a neutral mood. I wasn't really happy. I wasn't really sad. I was just kind of in between, not really feeling much emotion besides neutral.
Yeah, that's the sad thing about, I definitely meet with patients who are like, well, I feel like so like fluoxetine or one of these medications, like it helped with the depression, but what it actually did was it made it so I felt nothing. So I wasn't sad, but I also felt nothing. And that's, to be in your 20s and not to have like that experience. And we all have the emotional roller coaster of being in our 20s. I was on the birth control pill in my 20s, so I think I got a really extra dose of, of emotional roller coasters. But, with that, it's very, it's concerning that you didn't even know that you could switch your pill or there was another option. And it's something that likely because your doctor didn't know that like, oh, there's actually a correlation. And of course, that mood altering drug that they were giving you wasn't going to be, the fix that they were intending, because there's a different mechanism of action at play. And with women who are on hormonal birth control, we have issues with our tryptophan pathway and our B6, and B6 gets depleted. So we can't make serotonin. So then they give you drugs to try to keep serotonin around longer, but they're forgetting the fact that your brain's also on fire. So your brain's inflamed, and the female brain, no brain does well when it's on fire, but it misses that big piece of it, that, your brain has inflammation. And there's interesting research actually showing that while we're on hormonal birth control, why it may actually contribute to depression is because it causes us to make neurotoxins in our brain. Instead of making yummy, wonderful neurotransmitters, we make neurotoxins. And to that, it's like, well, of course, like a pharmaceutical that's intended for depression isn't going to necessarily work, because it's not that you have depression. You had, in the sense of like, this was something organic and inherent. This was a side effect of a medication that you were taking. So at 10 years, you decided to, and I'm going to say, like, I've talked to a lot of women, and 10 years seems to be the time when I did it as well, when all of us are like, yeah, no, like I need to come off of this. So what did that look like for you? Did you do anything to prep, or did you just stop? What was that experience?
So I had no idea that the pill depleted all these nutrients from your body and created those neurotoxins. I had no idea. I just decided, oh, maybe this is something that I shouldn't be on long term. My mom actually had a friend that had a stroke in her 30s because of being on the pill, because she was prone to blood clots. Mm-hmm. And so I had that in the back of my mind. I was like, oh, maybe this isn't the healthiest thing for me. So I decided, I'm just going to come off of it just cold turkey. I didn't talk to my doctor or anything. I just kind of made that decision. I was done with being on prescription pills totally. And so it was good when I came off of it, probably for like 3 months. My period was late the first month by about like 10 days or something. It wasn't bad. And then I was pretty regular. And then probably about 5 or 6 months after coming off the pill, my acne just like exploded. It was cystic, deep, painful, inflamed, red, horrendous. And all the while I was planning my wedding.
Oh, no.
And I was like, this isn't going to work. And so I talked to my doctor, and they prescribed me like a topical cream for my acne. Come to find out, the topical cream wasn't covered by my insurance, and it was like $300 or something ridiculous like that. And I was like, can't do that either. So I decided to go back on the pill for my wedding, because I knew that acne was the only thing that was going to be on my mind if that was like a continual problem for me, which it seemed that it wasn't going to go away anytime soon. So I ended up going back on the pill after, I think, almost a year after being off of it.
And
so that
did
was
it
really
help with the acne?
It did. Once I went back on the pill, it helped. It cleared up within 2 months, I think. But then about around Thanksgiving this past year, I decided that I was going to come off of it again, because now I don't have a wedding to plan, and I can more focus on my body now and focus on keeping my stress levels low and figure out how I can, be the cleanest, like safest version of myself that is healthy. So,
yeah. So like, let me just first say that wedding photos last forever, and that moment of time is captured forever. And so it's definitely understandable. And you're absolutely right. That cystic acne wasn't going to go away right away. I mean, it was going to take some time. The skin takes a little bit longer than everything else to heal, because it's a very benign organ in terms of like expressing things. So that's completely understandable. I'm curious, did you have cystic acne before you went to college?
No, I didn't have any acne. I would have like 1 or 2 pop up here and there, but nothing near what I had when I came off the pill.
Yeah.
Yeah.
So this is something that's a really common theme where, and it's part of post-birth control syndrome, in which there's the androgen rebound. Like suddenly your body's like, we can make testosterone again. Let's go hard. And I see this so often in my medical practice where women come to me and they're like, I've never had acne. I never had problems with my skin. After I came off the birth control, cystic acne. And it's not like, oh, I have a zit here or there. It's painful. It's red. It's inflamed. It's super deep. Where I was talking with a patient who's an esthetician, and she was asking me about it because she was like, I have women who come into me and like the extractions, which is like a procedural kind of thing that they do to actually, get some relief to women. And she's like, they're so difficult. They're like the most difficult. And she's like, I see this theme that it's women who have been on birth control. And so I always like to ask that question, like, did it exist before? Because I found that so many women, they did not have cystic acne. And if they did get on the pill because they were like, well, I had a zit or two, it is so bad where they have acne now all over their body, places where they're like, I didn't think I could get acne there. So you went back on the pill for a year because of that cystic acne, and because you were getting married. No one's going to judge you here. And if anybody's listening to this and they're judging, just stop that. Just stop that, because I mean, we've all done things, that are, they're meant to be temporary fixes. And it's nice that we have those options, that you had the option to be like, okay, I need a Band-Aid for a minute here because I have some stuff going on in my life. So you have now transitioned off. It's been about 7-8 months now. Did you do anything to prepare your body the second time?
Yes, I did. So before I came off of it this time, sorry, there's a truck going by. So before I came off of it this time, I really did a lot of research online. I watched a lot of YouTube videos. I read so many blogs. I just Googled the crap out of birth control pill and coming off of it. So this time about 2 months before I came off the pill, I decided to do a vegan diet where I became primarily plant-based, no meat, no dairy, low sugar, to kind of prepare my body. And I started taking vitamins like evening primrose oil and vitex berry to kind of prepare my body. Once I did come off of it, I immediately felt so much better mentally. It was like amazing how coming off of the pill could change my mentality so much. And I felt like I was finally treating my body the way that it deserved to be treated. And I'm just so glad that I did eventually come off the pill. And now it's for good, and I can really focus on myself.
That's awesome. And so did you, it's no worries on the dogs. where I'm filming right now, there's chickens outside and windows are open. So we might have chickens interrupting us.
Oh, good. All the animals.
Yeah, no. And in these videos, we have cats making appearance, so don't worry about it.
Okay, good.
But so when you went on the pill the second time, did you have any mood symptoms that time?
Not really. I changed the type of birth control pill that I was on to a triorthocycline. And it seemed to really subdue my emotions more. So it wasn't so like roller coaster kind of effect there.
Yeah, well, but I'm glad that I'm really glad, because you were also planning a wedding and your stress was super high, so you didn't need any of that. So I'm looking at you right now, and so for people who can't see you, I'm going to say your skin is gorgeous. It's
thank you.
Clear. What were some of the things? So you did the evening primrose oil, chaste tree berry, or vitex.
Yep.
And then you were making sure that you were getting a very nutrient dense diet. Anything else that you feel like really helped with your skin so that, when you came off this time, you didn't have the cystic acne? I'm assuming you didn't, because your skin looks awesome.
I don't have any cystic right now. Right now it's sort of almost like blackheads, which is really bizarre. I think it's more like I'm very oily after it being kind of contained for so long, and now the oils are just like going crazy. But other things that I did was I made sure that the products that I was using on my face were toxin free for the most part. I really focused on that, making sure that there was no parabens in my facial cleansers, things like that. I avoid alcohol, and I don't have dairy because I know those are two things that really drive my skin nuts. And just making sure that I wash my face twice a day, tea tree oil on spots that I currently have, things like that.
Yeah. And that oily skin, so, how it typically goes is when testosterone goes high, it starts with oily skin, then acne, then cystic acne. And if it goes really bad, then it's like hair on your chin and your chest and your abdomen. So that may be signs that testosterone is rising. And are you still using the Vitex?
Yes, I am. I will use it for 2 weeks after my period, and then the 2 weeks after and the week of, I don't use it. Because I've heard that you can go overboard with it and your body kind of needs a break from it every once in a while. I don't know if that's true, but
So if we call it day one, the first day of your period, is that when you start the Vitex?
Nope. The day that I end, I started.
Okay. So day 5, 7.
Yes. Yes.
Yeah. So we typically, I'm not your doctor, but I'm just say, generally speaking, what we typically do is we typically use Vitex at the second half of the cycle. So following ovulation, when we have like a sign of ovulation, or roughly day 15, because what Vitex does, it actually helps. So when you ovulate, what's left behind is the corpus luteum. That secretes progesterone, and that Vitex can help those progesterone levels, so that the luteal phase, the second half of your cycle, is easier when progesterone can be the main player. I would say try it out and experiment with it.
Yeah.
And then, another herb that can be really helpful is licorice root, and it's helpful. It's lovely for the adrenals, and it's great to take in the morning because it keeps your cortisol around a little bit longer. But it also has been shown to be beneficial with testosterone levels as well. And so that's something that we use, like with PCOS women, for example, and that have excess androgens. I use my adrenal support product with them because it has the licorice in there, and it has everything to really nourish their adrenal glands, because your adrenal glands can also be at play why testosterone levels go high. And so licorice is like that 2-for-1. It takes care of the adrenal glands, and it's also helping with those testosterone levels overall. I'm so glad to hear that you have a skincare regimen that is, very beneficial to your hormones overall, because that's always it's always astounding to me how dermatologists or, women will start using products where, you start looking at them and they're having hormonal acne, and then they're using products that are further aggravating their hormones and making it difficult for their liver to detoxify. And that's a big issue that we have with our skin, is that the liver has to be able to detox. Otherwise, if your liver's not detoxing, your bowels aren't moving, you're not drinking enough water, your body's going to put it in your skin. It's going to push it out of your skin because it has to get out. It can't keep these things around. So you did a vegan diet to prep your body for going off the pill. Did you continue a vegan diet? You're not eating dairy, which is, it's such a good share there, because dairy is like ubiquitous in acne, it seems.
Oh my gosh. Yeah. And it's so full of hormones in it. It's like insane. But yeah, I have continued with the vegan diet. I do eat fish and eggs that are free of GMOs and hormones. So those are the two things that I've added back into my diet, just because of those omega-3s. And I feel like my skin really and my body really needs that right now. So for the most part, yes. And I forgot to mention before, also to prep and throughout this kind of detox period of time, I've been drinking roasted dandelion root tea.
Oh,
and
love it.
spearmint tea. So to the dandelion root to really help my liver. So that's another thing that I wanted to add in.
Yeah. I love dandelion. It's it like breaks my heart whenever people, can you stop spraying Roundup, because that's just gross.
Oh, I know,
but
I know.
I'm like, why are you spraying the dandelions? Those leaves help your kidneys detox. Those roots help your liver detox. And I haven't had anybody share that yet, but I'm a big fan of burdock root and dandelion root for women's hormones. And it's something that I'm an herbalist as well. And so whenever I compound tinctures and I'm mixing them together, if there's ever something that I'm doing for hormones, I'm like, we have got to have liver supportive herbs in there as well. So I think that's a really big piece with that. And I appreciate you sharing that. Are you making your own tea, or are you purchasing it?
I'm purchasing it right now. Yeah.
It's amazing that we have these options these days.
Yeah.
Great. So for women who are watching this, they're struggling with some of the same things, like especially mood. I think mood is something in women's medicine that gets dismissed so often, and we're just told it's in your head, you just need a medication. And there's a lot of women that I speak with that are like, I know my hormonal birth control is why my mood has tanked, but my doctor is telling me it's not true. For women who are hearing this, they're relating to your story. Is there anything you would want to share with them?
I just want to share that, you can't always trust one doctor. You need to see multiple doctors, get multiple opinions, talk to your friends, talk to other women, talk to your mom, talk to everybody to, kind of get a sense of if anyone else has had these similar experiences, because chances are they probably have, and you'll hear someone else's story and they can share what they've been through, and you can kind of learn from each other's experiences.
I love that. And that is so true, is that we get shamed a lot for what we experience as women, and then we don't talk about it, and we struggle, and we silently suffer. And it is so healing for us to tell our stories, but it's when other women hear these stories that they recognize that they're not alone, that they can heal, and they understand what is possible. So I love that you shared that, because it's absolutely like 100% what we need more of, women actually supporting women and sharing their stories. So with that said, there's going to be women listening to this that are going to say, well, I want to learn more about you. I want to follow Mel. Where can they find you and, kind of, be a part of your journey as well?
So I have a blog, and it's earthyartist.com. And I'm also on Instagram, and that's at __earthyartist. And on there I
Two
share
underscores.
Yep, correct.
Yeah.
And on there, I just share kind of my story, exactly what I talked about today. And I post different things that I've done that help me, the vitamins that I take. And I link to various people that I've researched that also have great tips. So on there, you can find those things.
Yeah, I think you do a great job of curating things on your Instagram. So I'd highly encourage people to go check it out. And you're very candid and very open in sharing your story, which again, we need a whole lot more of. So I really appreciate you taking the time to speak with me today and share your journey. So I just want to say thank you, and we're definitely going to stay in touch.
Great. Thank you so much.